I'm humbled and deeply grateful to receive the American Society for Cell Biology 2020 Public Service Award. NIAID's dual mandate to support research on established diseases and to rapidly respond to emerging and re-emerging infectious diseases has profoundly shaped my 36-year tenure as director of the National Institute of Allergy and Infectious Diseases. I've been privileged to help lead the U.S. government response to multiple infectious disease outbreaks, beginning with the emergence of HIV/AIDS in the early 1980s, and including the anthrax attacks and bioterrorism, SARS, 2009 H1N1 influenza, Ebola, and Zika. Data-driven evidence, clear and honest messaging, global collaborations, and compassion for those affected were all integral to building public trust in science as the pathway to resolving these pandemics. Until this year, when someone would ask what I had not seen that worried me the most, I would answer the emergence of a novel, highly contagious respiratory virus causing high levels of illness and death. When 2020 began and SARS-CoV-2 came into public view, suddenly my worst nightmare had come true. It checked all the boxes of my concern. Once more, scientists around the world are joined with the public health community in a struggle to gain the upper hand over a novel virus and its manifold manifestations of disease. COVID-19 possesses the biggest threat to global health in more than a century. Tragically, at the time of this recording, it has caused the deaths of more than 1.3 million people worldwide. Here in the United States, cooler weather has driven more people inside, helping to fuel alarming new peaks in numbers of cases and hospitalizations nationwide. Our prevention toolbox currently consists of simple public health measures, such as universal masking, physical distancing, and avoiding crowds that work well when people adhere to them. Unfortunately, pandemic fatigue and flat-out rejection of scientific evidence are challenging our best mitigation efforts. Against this grim backdrop, heartening scientific progress continues, including encouraging data from phase 3 trials of candidate COVID-19 vaccines and the advance of monoclonal antibody therapies. In this regard, fundamental research advances clearly enabled us to hit the ground running and respond to this pandemic at an unprecedented pace. To cite just a few examples, advances in messenger RNA vaccine platform technologies, structural biology research underlying the rapid development of the SARS-CoV-2 spike protein stabilized in its pre-fusion conformation for candidate vaccines, and experience with broadly neutralizing antibodies for HIV and Ebola as models for the developing of monoclonal antibody therapies for COVID-19. Now, many urgent research questions remain that I hope some of you may help us address. For example, virus-host cell interactions relevant to the pathogenesis of COVID-19 and the development of effective therapies. As scientists, we know it is paramount in all our endeavors to let data and science-based evidence be our guide. As citizen scientists, it also is incumbent on us all to enhance the understanding of the scientific progress and its inherent checks and balances to build and sustain the public trust in what we do. Public trust is essential to ensure that the fruits of our research, such as vaccines, reach their greatest potential benefit. So thank you again for this wonderful honor. We are all in this COVID-19 pandemic together. And by working together, we will bring it to an end. So please stay safe, keep well, and continue your outstanding work.